Hi, my name is Barack Gasser. I'm a primary care doctor and professor of medicine at the University of Washington. And this is the third segment of the series on dementia in primary care. Um, this is the list of the topics that we're covering in this series. The first one was Introduction to Dementia in Primary Care. Second was how to do evaluation of cognition in a primary care setting. And this third segment is communicating a diagnosis of dementia or mild cognitive impairment. And so let's go back to the case that we've been following. This is the 82-year-old man who returned for a dedicated visit to assess cognition based on input from an observer, his wife, and his MoCA score, but still being fully independent with activities of daily living. We made a diagnosis of mild cognitive impairment. And so now it really sort of raises the question of how do we talk to somebody about that? That is an incredibly difficult and impactful diagnosis to make. What does it mean? How do we frame it? And I really would call this out as really one of the most difficult situations that we face in primary care, in that it is not always easy to immediately have a specialist who is expert at a highly impactful diagnosis like this, as there is with dementia. So I think I used the example before of lung cancer. So generally speaking, if you diagnose somebody with cancer in primary care, there can be that initial sort of difficult conversation about the diagnosis, but then you almost have this kind of easy way out, because you can say, you know, don't worry, I'm going to get you in to see an expert on this right away who's going to be able to talk to you about prognosis and treatment right away. I can get you in within a week or two. And that is the case for many other sort of super high impact diagnoses that we make in primary care. But dementia, even mild cognitive impairment, sort of rises to sort of out of that as really somewhat unique, in that it is emotionally difficult to talk about and to hear about, and we don't necessarily have that super easy access to a specialist who can sort of take over right away in terms of talking about what does this diagnosis mean, and what is the path going forward. And so this really is one of the most important situations in primary care, to really step back and think about, you know, how to have a really highly effective conversation with somebody about something that is really serious and difficult in primary care. And a tremendous amount of work has been done in this area, not necessarily about dementia, but just on general difficult conversations, period. And, you know, again, so important to make sure that a family member is there for this conversation. True for any serious illness conversation, but even more important for something like cognitive impairment, where the patient's memory of the conversation is going to be somewhat impaired. You want to set the stage, really prepare somebody for hearing bad news, and the really useful phrase that serious illness training really focuses on is really making sure that at the beginning of the discussion, saying something like, is it okay if I share with you what I think is going on? Which at first can feel a little bit sort of strange to ask, because of course they're going to say yes. It's not. It's a little bit of a trick question, where you're really not asking for a yes or a no, but you really are asking for their permission, and really are asking, what you're really saying is, are you ready now? I'm about to tell you something really serious, and I want to just make sure that you're prepared to hear it. You really want to acknowledge that it's scary, but you also want to share some hope and some optimism. You know, you want to say, we're going to sort of, you know, we want to be, it's good that we're going to be prepared for the worst, but I want you to know that I am optimistic and hopeful and it's good for us. There are really such good reasons for us to know and plan about this diagnosis. You really want to make sure that you're showing good ongoing support. So, the most devastating way that a conversation like this can happen is the kind of like diagnose and adios sort of step way where you feel what you leave people feeling devastated and without sort of the hand there to sort of partner with them. And so you really want to really set up a follow-up meeting with them, and whether that's in 2 weeks or 4 weeks or 2 months or 3 months, you want something sort of on the books, again, with the family member there, just to sort of lay the groundwork that you are there as their partner through this diagnosis, and that they will almost certainly have another family member who sort of wants to sort of join and ask questions, or they will have other questions that have come up between now and the next visit. But it's also, as is the case with all serious illness discussion, you want to be clear. I mean, I think one of the other big pitfalls that can happen is we kind of like dance around the wording, and we never actually use the word cancer, or we dance around the wording and we never actually use the word Alzheimer's, that may not be a definite diagnosis, but at least is the big elephant in the room. And so it is important to be clear and honest and transparent about what you're thinking. And so, another pitfall is people can walk away, just all they hear is the diagnosis, mild cognitive impairment, which may very well be the diagnosis. But if that's all they hear, it may really miss the mark in terms of communicating clearly what you think is going on, which is that there is a 70%-ish chance that they could be in an early stage of dementia, and that this very well could be, and maybe is even likely to be, Alzheimer's disease. And so you want to clearly communicate that this is something that's on your mind, and that hiding this from them is not effective, good care. It's not what most people would want. Most people would want to know what you're thinking, and that is, if they have mild cognitive impairment, really explaining and describing what this is. And so, using a phrase like, I'm worried that there's a high chance that this is early Alzheimer's, but I'm not sure about it. It could turn out to not be that. We need to really watch closely and repeat this evaluation in a year. You also want to be careful of causing too much alarm. And so you want to say, there are positive, good things that are coming from this assessment, and that we really do need to sort of engage and work together on this. And so let's look at some positive changes that we can make, things like hearing aids, less alcohol, less Ambien. And you want to leave the hope and optimism, which is that even if this is Alzheimer's disease, it is very likely to progress very, very slowly. And so even if it does get worse, it's going to happen over many, many years. And there truly are many years ahead of good quality of life where you are going to continue to be very, very close to the person that you are today. You want to set a path forward in that, like I said, many years of good living left to come. And, so you're pairing that concern with the optimism. This might be early Alzheimer's. There's a chance it might not get worse. And saying something like that, you can, it's not that you shouldn't use the word mild cognitive impairment, but don't just say mild cognitive impairment. You really do need to effectively communicate that this might be Alzheimer's. And in fact, it is even likely to be Alzheimer's, but there's a chance that it may not get worse, and that it may not be Alzheimer's, and that it may be very, very similar a year or two from now than it is today. And unfortunately, there's not a lot that we can do to be more sure of that. But again, this is the shared decision-making moment where somebody or a family member is really concerned and does feel like they would like more sort of prognostic or sort of diagnostic information, that sending somebody for neuropsychological testing is a perfectly sort of good, reasonable, and valuable thing to do at this point. But that, really putting the positive sort of aspects of what your assessment and plan is out front, which is that doing things like staying active, staying engaged, having regular sort of exercise, having a healthy diet, referring them to community resources can really help people to stay more engaged, more healthy, and can keep their brain functioning better over time. And so here I want to share some beautiful phrases that come from the really well written guidebook that comes from the University of Washington's Memory Brain Wellness Center. It's called Living with Memory Loss. Anybody can download it for free from the web. It's an 80-page booklet, so it doesn't sort of it's not easily sort of downloadable from the web, but it's there. It's got good sort of pages to sort of look at and pull from. And to me, the most sort of useful page in this entire booklet is this page that's called Key Messages to the Newly Diagnosed, where you really do want to have phrases like this sort of in your pocket that you really can share with patients and families as you're delivering a diagnosis of mild cognitive impairment or dementia. And you want to say things like you're not defined by your disease, that you have people who love you and who you still have things you like to do. And that living with memory loss isn't easy, but there are ways to cope by keeping lists and by a healthy routine, by exercising. You really will feel better. You'll think more clearly, and you'll find ways to still enjoy your life. And that, again, like leaving people sort of connected with that support, that you will not have to walk this path alone, that your family, your friends, and me are with you as you move forward. Another really good resource to have on hand is a booklet put out by the Dementia Action Collaborative in Washington State called Guide for the Newly Diagnosed. Again, this is available for free as a download online, but it's a beautifully formatted and designed booklet that really does sort of work best as something that is sort of printed out and in your hand. It is actually really easy to order free copies from the website. So if you just Google Dementia Action Collaborative Guide for the Newly Diagnosed, you'll see it there, and there is an email address that you can request a box of free copies be sent to you. Highly recommended, really nice to have this on hand to be able to hand to a patient and family at the time of diagnosis. Another fabulous resource that the Dementia Action Collaborative have put together is the Safety Kit for Families. This is maybe like the thing that you might do at that next follow-up visit, because at first people are pretty sort of overwhelmed with all the stuff that they're trying to absorb, and so it's not necessarily something that you're also going to sort of hand them at that very sort of initial disclosure visit, but in maybe the next one after that or the third one after that. Having this Safety Kit for Families is super useful. This is actually really easy to just sort of get online. It's really it's a one-page sort of resource guide for sort of things in the community that will help with home safety, fall prevention, preventing elder abuse, and financial exploitation. Highly recommended Safety Kit for Families by the Dementia Action Collaborative. Another really super important resource that really can help to help patients feel supported and especially caregivers supported is a course called Powerful Tools for Caregivers. It is really perfect for caregivers taking care of a family member with dementia, but it really is it's designed to support family caregivers, helping care for lots of different diseases, in which really the challenge as dementia progresses and gets worse is just what a tremendous burden this can place on caregivers. Like the amount of burnout and exhaustion and depression among caregivers is really overwhelming, and is, as dementia gets worse, I think one of the most important sort of pearls to share is that the caregiver is almost as much your patient as the patient with dementia, because they are suffering, they can suffer tremendously. And there are really good tools that they can learn through a course like Powerful Tools for Caregivers that can really make a difference in reducing depression, reducing burnout, improving care for the person with dementia, and really taking care of the caregiver. So these are free 6-week classes that are, this is a nationwide effort. And if you go to the website, powerfultoolsforcaregivers.org, you can find classes that are offered throughout the country. But I mean, really, the hardest part of most of these discussion about a diagnosis visits is just how much uncertainty there often is. You know, you don't know what the prognosis is. You don't oftentimes even know for sure, is this dementia or mild cognitive impairment? And so, and so it's just worth acknowledging the uncertainty, becoming comfortable with it, and learning a little bit sort of how to communicate about it. You know, and this is really one of the things that we do a lot in primary care. We're good at this, and you know, this is a disease in which the prognosis is really hard to predict. If it's mild cognitive impairment, it may not progress at all. If it is dementia, it may progress quickly over 6 years, but it could progress very, very slowly over 20 years. And I think regardless, the important message is that for many years, you, the patient, are going to be very near to where you are now. That this is not a horrible death sentence that that, you know, prepare your documents because the end is nigh. You really want to say that I'm here with you. I'm seriously hoping for the best, but I will also be here to help you sort of way down the road if things get worse. And let's meet again in 2 months with your family again here, and any other family members you'd like to bring along for follow-up, so that we can hear how things are going. And I can absolutely imagine that you'll have other questions that will come up between now and then that we can address at that next visit. And so then, you know, so this is a hard conversation to have. This is a hard visit to prepare for. It is often that people may push back and say, I don't believe you, or I don't think this is really what's happening, or I feel fine. And there you want to have good phrases sort of at the ready, so that you sort of can acknowledge and empathize and say things like, I understand this is hard and unexpected. You know, let's keep talking about this at future visits. And, you know, just as long as you make sure that you are emphasizing how important it is to have family members with you at those future visits. And, you know, I think one of the most useful tips that I've gotten from serious illness training is thinking about these discussions as if you were performing a very difficult procedure. I mean, I think this is, you know, one of the most brilliant parts of Atul Gawande's book, that Being Mortal, where he really does talk about sitting down for these conversations as technically challenging as the most complicated surgery situations that he is in, and that in the same way that you are sort of mentally sort of preparing yourself for doing a difficult procedure, you want to mentally prepare yourself for having this difficult conversation. You need some time to sort of plan in your head sort of how the conversation is at least going to get started and what directions it might go in. And just like any procedure, it gets better, it gets easier with practice, and also is better if it is not sort of rushed for time. And so really, this is another situation where scheduling a longer slot than your typical short follow-up primary care visit is so valuable if it's possible in the care setting that you're in. And again, just like the value of more than one family member being present, because this is the point at which you really are getting the big value out of that earlier diagnosis, is bringing the family in for support and understanding, and they're going to have questions, and rather than sort of oddly sort of trying to have conversations with them that you may feel kind of like a little bit weird having sort of without the patient there, having more than one family member present for a follow-up visit like this is so useful and important. And that may require a larger room than the typical primary care exam room, which is a logistical challenge in many primary care clinics. But I really do think that dementia brings up a situation in which having a larger family conference room that can be scheduled in a primary care clinic has tremendous value. So that's the end of this segment on communicating a diagnosis. Thank you for listening. The next segment is going to be medications to treat dementia. Again, this is effective and efficient dementia in primary care. And again, my email address is here. Feel free to email me with questions. And thank you so much for listening.